Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, Stephanie Desmon talks to Delali Attipoe from the nonprofit medical research organization Drugs for Neglected Diseases Initiative, or DNDi. They discuss neglected tropical diseases, parasitic and bacterial diseases that impact 1 in 5 people on the planet, the work her organization does to develop suitable treatments, and why we're seeing an uptick in these tropical diseases in the United States. Let's listen.
Delali Attipoe, thanks so much for joining me.
Thank you, Stephanie.
So you are the head of the North American branch of an organization called DNDi, and I'd love it if you could tell our listeners briefly about your organization.
Well, I think one of the things we'll first start with is what is DNDi and what does it even stand for, right? So DNDi stands for Drugs for the Neglected Diseases Initiative. And so we're a non-for-profit organization that's really focused on how do we discover as well as develop treatments that are really needed for neglected disease areas and for those populations that would benefit from them.
Mm-hmm. And you're going to have to, if you don't mind, what are neglected diseases?
Neglected diseases actually affect around 1.65 million or billion people around the world. And so it's a little bit of a misnomer sometimes when we call neglected tropical diseases, which is what NTDs stand for, to say that it's neglected. But it's really neglected because we don't really have a number of treatments. When you think about traditional drug development, R&D, or research and development that's done for disease areas, they're typically not focused on. And so one of the areas and reasons why DNDi in particular focuses on neglected diseases is because we've really found a mismatch and a fatal imbalance with how R&D is structured to really be focused on NTDs.
Tell me a couple from examples of NTDs so that people understand what we're talking about.
Yeah, so NTDs can range from disease areas like malaria, tuberculosis, HIV at one point, even though a lot of people have heard of HIV, of course, really kind of fits within that neglected tropical disease spectrum. But then you also have diseases such as mycetoma, NOMA, which was recently added to the WHO neglected tropical disease list. You have diseases like Chagas disease, leishmaniasis. These are diseases that most people necessarily haven't heard of, but yet affect 1 out of 5 people across the world.
So why is there this disconnect?
Well, it's really when you kind of think about what is the prevailing research and development for-profit-oriented model look like. And because these diseases predominantly affect within low and middle income countries, the prevailing model doesn't focus in on these disease areas for really coming up with innovative treatments. And this is really hence why an organization like DNDi exists and really came to fruition about 20 years ago, was that so that we could change that paradigm and make sure that we had effective research and development going towards these neglected disease areas. All of the
above. And you do this by working with public sector, private sector,
DNDi was really created with the mission in mind that we wanted to be able to work as what we call a virtual orchestra with a number of different stakeholders to really ensure that we would be able to develop treatments that would have faster access to the patients that needed them. So we work with industry and private sector, we work with public sector, and we work with academia. Those areas or institutions that are interested or doing work that we can do to help accelerate development of treatments we work with and partner with.
So when it comes to the United States, we don't have a lot of these NTDs, but I see that we're getting more.
I mean, you have to think about what's happening in terms of the climate shift that's occurring at the moment. So we are starting to see a greater increase in the number of diseases that would traditionally be thought of as happening in one spectrum or geography, and we're seeing them within areas within the United States. One of them, for instance, being Chagas disease, which is caused by what we call the kissing bug. kind of landing on you and depositing fecal matter, for which that parasite really invades, and sometimes for which patients drop dead. About a third of patients later on might drop dead due to a cardiac event. Typically, we've usually found Chagas disease present in Latin America, but given that climate change, vector control, all of it is shifting north. You're starting to see a lot more of these diseases in areas that you haven't typically seen. We have a number of Chagas cases, for instance, in the United States, in Texas, in Florida, in California, about 300,000 cases, actually, in fact. So it's not an insignificant number. Dengue disease, it was almost pretty much the year of dengue fever last year in Europe, in the United States. You saw increases in terms of that particular disease, not just in areas where you've heard about it within Latin or Southeast Asia, because of the fact that you're seeing mosquito spread in terms of where they're ending up. And climate change is certainly accelerating that pace with how the migration of these bugs are moving in the environment.
I'm stunned that you said 300,000 Chagas cases in the United States. I mean, stunned.
Mm-hmm. And that's probably even an underestimation, Stephanie. We don't have great diagnostics, and that's one of the areas where DNDi is really committed to working with partners to improve, as well as the need for better treatments. The prevailing treatment that we have is something that's coming from out of the 1970s. We need to have better treatments in order to treat diseases like Chagas, because as we know, these diseases really have no borders.
And are you working with the folks developing these treatments?
We work on treatments that span from early discovery in terms of running a number of screening libraries to see if we can find new compounds, to are there currently repurposed drugs that we could accelerate in terms of it being a new indication for new diseases. Chagas in particular is a very hard one and a nut to crack, just given the method of action for which this particular parasite hides within one's body. But we work with, we have partners in academia. We're working with a number of partners in biotech as well, too, to see how we can actually accelerate certain treatments. So we do work, we have our scientists as well as partner with other scientists in these spaces to look for new treatments.
A pattern I've noticed, and I'm sure you have just as much, is that things happen around the world and they don't get a ton of attention and a ton of money. Now that some of this stuff is headed to the United States or is in the United States, do you think that, ironically, will help to sort of fund some more of these ventures and increase development?
Well, one would certainly want to hope so. Of course, whether or not the diseases are residing in the United States or are external to the U.S., really, DNDi is really about, for those patients who are most neglected, how can we ensure that we get access? But certainly, even when you look at historically the number of public institutional providers who have funded global health spaces, particularly when it comes to NTDs, the United States has been a staunch supporter in terms of resources in that regard. Now, of course, global health funding in general is tight across the board, and we would like to be able to make sure that people are very aware from a public advocacy and policy standpoint that these areas are of critical importance because, again, our borders are not necessarily keeping out any sort of one vector or not just because of where one is within the globe.
That the global funding scenario, worries a lot of people these days. I'm curious, how do you sustain gains in a time of uncertainty?
Well, that's a great question. And I think it's a matter of continuing to partner where we can. So given our partnership model of trying to see who like-minded institutions, organizations, we have to be able to continue, one, as I mentioned a little bit earlier, around the policy and advocacy component so that people continue to realize the importance in various different settings. But then in partnering with both private and public actors who have an interest, as well as continuing to raise it in front of people who might have not traditionally been involved. So maybe some mid or smaller level philanthropic foundations. Because we've gone through COVID, because people are a lot more tuned to the fact that we have a need to focus on diseases that might not necessarily look like a COVID in terms of what we had to deal with, but it can develop and get much more broadly extended. So we need to be able to pull in people who are aligned in terms of mission, but then also educate so that people understand the importance so that we can raise the funding that's needed and required to sustain at every level.
Yeah. When you tell people you work in neglected tropical diseases, I mean, do they know what you're talking about? Or is this something that you're doing education all the time?
I think it's a matter of both, right? So I think it's also connecting back, and you mentioned this a little bit earlier, Stephanie, like, how do you connect this with a U.S. audience, right? And who might not think that there are neglected diseases as well. It's like, well, actually, there are, right? We don't live in an isolation. And I think people understand that, especially, again, coming out of the pandemic, but also connecting with one's own personal stories, right? I love to travel. And for myself, one of the things that I had never heard of dengue, for instance, before probably just a little over 10 years ago. And I happened to be traveling and came down with dengue fever myself and had also some personal experiences with malaria. I think as people tell their personal stories, as we have doctors who are coming back from their own vacations on some of these things, and as people are much more globally connected, amplification around these stories and connecting that way, I think can help and go a long way.
So what do you see in the future? What's your vision for the future here?
It's a great question. So for me, it's about connecting the personal with the global and the local, right? So recognizing that this kind of goes back to the storytelling of being able to tell our success stories within global health. I don't think we do that enough. And I think there's an opportunity to continue to amplify around the great work that people who might not think that they're surrounded by entities have actually helped to contribute to, whether that's in donations or because they're going abroad and they're seeing also what might be happening in certain communities. I see a vision where everybody understands that if we don't take care of immediate neglected tropical diseases, it can also affect them and their families, and that raises the level of engagement. Let me give an example. So DNDi being formed 20 years ago, one of the key neglected disease areas of what we focus on is sleeping sickness. And at the time, the existing product that sleeping sickness was treated by killed 1 in 20 patients because it was an arsenic derivative. Completely unacceptable. Any parent, whether you're here or anywhere, would never find that acceptable, right? But what DNDi was able to do with partners, for instance, like Sanofi, with partners on the ground in Guinea, in DRC, was that over the years, we were able to develop better generation of treatments that, one, wasn't an arsenic derivative that killed out of 1 in 20 people, but then also ended up being oral doses that made it easier for patients to no longer have to suffer those debilitating disease. And we're now at the cusp where hopefully we'll get registration for now a single oral dose treatment that will now, we're looking at a place of disease elimination. And so to say that story in a 20 years time frame, and I came from biotech, from industry, where it can take you like 20 years to develop one product, where DNDi has been able to develop 13 treatments in the 20-year time frame because of partnership and collaboration, working on ground with clinical trial networks. We're now almost able to say that we have an oral treatment for disease elimination purposes for sleeping sickness. And I think it's the importance of having a future where we can tell and articulate those stories that will continue to fuel kind of a flywheel and hopefully accelerate the progress on a number of not just neglected disease areas, but other disease areas where there's open collaboration, open science, and partnership that can get to solving these hard, tricky diseases that we often sometimes don't make much progress on.
Delali Attipoe, thanks so much for your time.
Thank you, Stephanie.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.